Hello and welcome to Seven Sentinels. This is Grand Master class and I'm Peter Simon with you. Today we are conducting speaking sessions and now we have Samiullah Khan from Hyderabad, India. So this is a role play card. Yes, sir. Mr. Sami, once you're ready, you can start.
Can I start?
Are you ready?
Yes, sir.
Yeah, speak little loudly and you can start now.
Good evening. Thanks for allowing me to to check the vitals. Mr. Lincoln. Okay. Would you mind if I ask some questions, Lincoln, to you about regarding your child?
No, nurse, I am very much flexible. You can ask me whatever you want and I'm ready to give you the information.
Okay, thanks for the allowing me. How long she has been suffering with these symptoms?
Actually, I have brought my daughter to the emergency department because she has chest tightness, wheezing and difficulty breathing. I don't know exactly what happened, but she has had this problem for almost 1 hour. She was running around in the garden when she started having difficulty breathing. The symptoms are less severe now than when they started. I haven't given her any medication as I wasn't sure what to give her. She has never had anything like this before.
Thanks for the providing essential information, Lincoln. Okay. Okay, Lincoln. One more question, if you don't mind, please.
Yes.
What about her general health? Has she had any recently before any illness, or she's on any medication right now?
Actually, my daughter is generally very healthy. She hasn't been ill or sick during the recent times. And currently she is not on any medications. Actually, she is fit and fine, nurse. Yes, please.
Okay, Lincoln. I completely understand your concern, Lincoln. Any family history of asthma?
My spouse had asthma as a child, but I don't think anyone else in the family has had asthma, hay fever, or eczema.
Okay, Lincoln. As per my examination, I can say her condition is stable, and along with that one, her vital signs are completely stable. There is a mild wheeze. There is no kinds of concern. So next step we will run about that. The doctor will come and assess her more, and he will provide the best treatment. Do you have any questions so far in the meanwhile time?
Yeah, I just want to know why, I'm very sure. I want you to confirm if my daughter has asthma. I'm very sure, I'm pretty sure she has asthma because of her symptoms, and also because my spouse had it as a child. Why don't you just check the vitals and confirm that, nurse, to me?
I'm really sorry to say, Lincoln, because I'm not an authorized person to diagnose your child and provide appropriate treatment. But I can do that to a minimal treatment by providing a nebulization, which will make her to comfortable to relieve with the symptoms. But in the meanwhile time, I can straight away inform to the doctor that your daughter is experiencing with the symptoms. So he can come as soon as possible, and he will provide the treatment at the best for your daughter.
Yes, nurse. Now, what should I do? What do you think I have to do? Because I don't think I need to wait too long for my daughter to see the doctor.
Okay, Lincoln. I completely acknowledge your concerns. If I were place, I will definitely react the same way. Being the father, I completely understand your situation. So I can do that. So there is a little bit busy because we have huge patients today. So there is a number of but there is a number of doctors available. We have treated successfully with the disease as your daughter is experiencing with so far. He, uh, he will come and he will do the best treatment for your daughter, and I can inform you as soon as possible to the doctor.
Fine. So what am I supposed to do, nurse? Okay, I agree with you. So till the doctor comes, what am I supposed to do?
Just to wait a couple of minutes with Lincoln. As I mentioned that he will come and he will examine to your daughter as soon as possible, and he will provide the best treatment for your daughter.
Yeah. Thank you very much, nurse. I'll go back to the waiting room and wait there until the doctor comes, and so that my daughter can be called to see the doctor. Thank you very much for your kindness and patience, nurse.
Thanks for the when to the proceed to go ahead, Lincoln. Okay, as I mentioned that I will straight away I will come to the doctor and he will provide best treatment for your daughter.
Yeah. Thank you once again, nurse. So now let us see the feedback here. The feedback. Yeah. So, right. So you are doing very well, no doubt regarding that. But it's not extraordinary. It is just above average. It's above average. You're doing fine, no doubt regarding that. Better than many other students. Okay. You said okay, okay. You're using okay too much, and then in between you are stammering to, to. You did not know what to speak next. So you are confused little. So they stopped a minute, stopped a second or two or three. Then you recalled everything, and then you started again. The next one, ordinary sentences. You are using ordinary sentences. Try to use some better quality sentences. Don't use ordinary sentences. The tone is flat. The tone is flat. I am going to the mud. I am going to the market, or something like that. Some change, variation, not flat tone. I'm going to. I'm going. I am going. Or some variation, some sounds. The next one, flat tone. Then you are saying once or twice. And these unnecessary sounds are creating some confusion. What he's going to do next, like that one. I'm waiting for you, like that of attitude. Then pauses and breaks. So minimize these pauses and breaks, and then avoid this I and you as far as possible. Try to use passive voice. That will be cutting down these unnecessary words. And don't repeat any words. Don't repeat the words a second time. Don't repeat. One time you said, that's finished. There is the matter. The next one, what you can do is Okay. So what you can do is you can write your own sentences and quality sentences. You can learn. I'm giving number of sentences in each and every role play feedback. I'm giving you different sentences. For you, I'm going to give you like this. I am ready to support you in any way possible. Supporting you in every way possible. I wish to support you. I wish to support you in every way possible. But I have some limitations. Because of my profession and because of the responsibility. I am not the authorized person to diagnose your daughter. When the doctor comes, when the doctor arrives, examination will be done, assessment will be done, and the condition will be diagnosed, and the prescription will be given. So it is better for you to wait for around 10 to 15 minutes in the waiting room. And when the doctor arrives, I'll call you. You can get along with you, your daughter, for the examination. How does that sound? So this is the way how you can, use quality sentences. Because I am a nurse, comma, I'm not the authorized person to diagnose your daughter. And therefore, my humble request is, to you is to sit and wait in the visitor's room or the waiting room for 10 to 15 minutes. Once the doctor arrives, you will be summoned to present yourself, present your daughter for the examination, physical examination. You are welcome to accompany your daughter. And if you have any queries, you can have a face-to-face discussion. Or you can have a discussion across the table with the doctor, and all the necessary information will be provided. And the relevant prescription will be given. And all your queries, if you have any, will be answered appropriately. See the way how I am talking. So this is the way how you can use your sentences. You cannot speak spontaneously. You have to practice a lot so that you can speak spontaneously. So this is not the stage how you can speak spontaneously. On the spot, you have to speak. Your concerns are absolutely reasonable. On the grounds of the family history, I mean, your spouse has asthma, has had asthma as a child. You doubt the same for your daughter. this assumption may or may not be right. It's just an assumption. We cannot take it for granted because it depends on person, place, time, and situation. In all the cases, the children may not be affected. It is restricted to only a limited percentage. Hope for the best. There is nothing to worry at this juncture, and worry will not solve the problem. Confirmation of the condition is important, and based on that only, you can take the future actions. So, there is nothing to worry about this condition at the moment. If the diagnosis, if the condition is diagnosed, if asthma is diagnosed, after the doctor's assessment and the relevant laboratory tests, the treatment plan or the treatment modalities will be provided to you, and all the education regarding how to manage the condition in the future will be provided. Alternatively, if the doctor says that she doesn't have asthma, you can be rest assured and just relax. So I request you to kindly wait until the doctor arrives. I hope you agree with this request of mine. So this is the way how you can add a number of sentences. From these you can take few sentences, that's enough. Then coming to the point, your grammar, there is some problem, you can rectify. Mistakes are very few, but the quality is not very excellent. You can understand when I spoke these sentences, you also can speak, but you did not think of this much depth. If you think in depth, then you can answer broadly. That's the problem. That's the hindrance. The next one is vocabulary. Improve your vocabulary. Try to use C1 and C2 vocabulary on a daily basis. Take all the words C1, C2 and try to use these words in your speaking. Then the pronunciation. You're fine with pronunciation, no doubt regarding that, but still you can improve the quality of your pronunciation and learn new pronunciation patterns. Fluency is there, but here and there are pauses and breaks and unnecessary sounds. You can improve your condition by learning how to overcome these problems. For example, if you have the problem of pauses and breaks or unnecessary sounds, this is the condition you have to keep. Zip your mouth tight. Deliver the goods, close your mouth. Deliver the goods, close your mouth. So what you're doing is you're starting something and in middle you're getting stuck and you're still opening the mouth, so sound is coming. I went to the market like that. So that's a weird, little, not fine. It gives distraction. It makes distraction. Some distraction will be there. So avoid these unnecessary sounds and pauses. Just close your mouth. When you think that you are not able to get anything, instead of opening your mouth and keeping like that, just close your mouth. Make it a habit. Make it a habit. You should realize that you have nothing to say, but that particular second, automatically you have to close your mouth. So never keep it in open position. Never, never, never. Just close your mouth. Once the matter is done, delivered, everything. In the morning, I went to the market. In the morning, I went to the market. Make it a habit of closing your mouth immediately once you deliver the goods, and once you realize that there is nothing more to say, then you can just zip the mouth. That's what I can tell you. So that's all for your feedback. Now this is the general feedback, and in-depth word-to-word, line-to-line feedback. I'm already getting the things typed, artificial intelligence already typed, and we are going to edit that one. And you have seen Nina Johnny's document. Go through that. Like that you will also get. And after keeping that one on the screen, I will correct you word by word, line by line. So in the meantime, follow up all these things, work hard, and improve your scores. Now you have 2 minutes to voice your feelings, opinions, and your feedback. Your time starts now. You can tell anything, how the improvement is there, how the feedback is beneficial, how the session was, what did you learn from the previous sessions to these sessions, what was the style in the beginning before joining Grandmaster class, and after joining Grandmaster class, how do you feel? Are you comfortable or not? Why do you feel comfortable? What things you are gaining? Everything you can speak, whatever you want. 2 minutes is the maximum time. Yeah, your time starts now.
Thanks for the feedback, sir. I really appreciate it. One thing that after I joined the class, I really got to know how to speak. Most of all, most important is that the tone, how to the way of speaking. I real trying very hard to maintain the tone. Like you already mentioned that regarding my tone is completely flat. That's the only thing, I think that's the only creating for me problem. That needs very much improvement and grammar. Your tone is like good, so I need to like into. I'm just observing your tone and how need to I speak uh, by hearing your tone like any like plan like up and down. That is I need to very much concentrate and grammar. And after speaking the complete sentence, you must be like taking the pause, not the middle of that. That's a creativity issue. These are things I observed after joining the class. I never had a feedback this one is before because I already took classes in speaking, but I never got a feedback like.
Okay, that's very nice. Thank you very much for your valuable feedback. And to the viewers on the YouTube, this is the style, Grandmaster class style. We are unique. We are second to none. And we have some special quality, and we deliver the goods what you require. We take every individual as a priority, first priority. And we'll give them time to prepare. And then we'll take the role play as we have done now. Then afterwards, we'll give a general feedback, overall feedback, how to improve, why you are doing like this, what are the problems, all these things we'll discuss. And then we'll tell them how to overcome their problems in our feedback after the role play immediately. Then we have artificial intelligence with us. we get it typed. Everything will get typed and it will be documented. It will be documented, and then the documents will be given to the students. It will be like this. What all you speak will be given like this. Interlocutor, grandmaster, that is Simon Peter, and this is nurse Nina Johnny, that is the nurse. So like this we'll have, and I'm going to show you. Okay, sorry. Yeah, I'm going to show. Okay. Yeah, here it is. I'm going to show you the document now. Open. Yes. This is audio scripts. This is number 1. This is how we'll give you your speaking session. So this is the speaking session. Warm up number 1. Speaking, Nina Johnny, nursing. These are the important words. Very important words. Then this is the way how we start. These are the questions and these are the answers of the warm up. And this is the way how you can take them. And mistakes also we will tell them, we'll discuss the next stage. We have got the document like this. After that, we'll call you live session and we'll create another video where we are going to do the editions. We are going to do edit your PDF like this, review. We are going to review your work like this. Now let us see here. Okay, Mr. Lincoln, I really understand your cancer. Your concern. Your concern. Now I'll put wrong here. It should be concern like this. We are going to give this sort of feedback. So mistakes will be shown in red mark and improvements will be shown or corrections will be shown in blue mark. So this is the way how we are going to correct your speaking cards. So if you are interested, you can get back to us and you can register, you can subscribe for Grandmaster class and you can get all this quality from us. That is what I can tell you. So you can contact me on 98. You can contact us on 9877867360. I repeat, +91 9877867360. Contact us for subscriptions. We mainly focus on doctors and then the nurses, and afterwards all the other 10 professionals. But most of them are doctors and then nurses. So contact us. That is all for now. Thank you very much. Have a nice day.